Hey there, it's Dr. Justin Marchegiani. Welcome to our live Q&A session. Let's dig in. I got a lot of questions in the queue, so I'm excited to dig in and break it down. Also sipping my nice ginger tea. I blended up some great ginger tea here this morning. It was excellent. Organic ginger, hot water, squeezed a full lemon in there. You can do lemon or lime. And I'm experimenting. I'm actually, instead of doing honey, I did royal jelly. And royal jelly is pretty cool. It's a specific type of honey they use, and it actually can grow the queen bee. It's what they give it to the bee, and the bee becomes the queen when they eat the royal jelly. So pretty powerful, really good immune benefits. Excellent. All right, so let's dig in here, y'all. Got my questions queued up. All right, let's rock and roll. Jack JMC writes in, does overeating all the time cause any problems later on? Well, I mean, it depends, right? If you're overeating, it's going to take more effort from your digestive system, more acids, more enzymes to break everything down. So as long as you have enough acidity to do it, you're okay. Of course, they can tax the digestive system. So my recommendation is eat till you feel about 80% full, and eat enough so, within 5 hours later or so, you're relatively hungry again. And of course, you can always use more enzymes and acids to help. If it's like the holidays and you're going to be eating bigger meals, HCl enzymes are always a great place to go. Kitty writes in, Dutch test, why would cortisol convert totally to cortisone in someone who is stressed and infection-free? So typically, like, cortisol is more of like the inflammatory stress. Cortisone, from what I've been told, is more like it's a weaker steroid. So it's typically used in less stressful situations. So I've heard, more emotional-based stress, where cortisol is more inflammatory-based stress. So cortisone's a weaker steroid, so typically used for not as stressful situations. More physical stress, physical inflammation will tend to rely more on cortisol because the tissue's actually inflamed and it needs more support. Lisa writes in, I'm postmenopausal 2008 with Hashimoto's thyroiditis and RA, so 2 autoimmune conditions. I've gained almost 30 pounds in the past 3 years while eating 1,600 calories a day. I'm not sure what changed, same meds and dosage. So number one, we'd have to actually see, Lisa, where your hormone levels are at with the thyroid, because it may not be adequate. Your doctor may be just looking at TSH, if you're lucky T4, right? Where have your antibodies gone the last 3 years? How are your T4 and your T3 conversion levels? How's your T3 levels? How's your cortisol and adrenal levels? How's your gut function? And then also calories. I mean, 1,600 calories of sugar versus 1,600 calories of fat or protein combined has a totally different effect on your hormones. Calories interplay differently depending on the macro and micronutrient quality of them and the inflammatory quality on your hormones. So calories aren't the whole thing. It all depends on the nutrients and the inflammatory qualities attached to them. So we'd have to dig in deeper to figure out what's happening with the micro and macronutrient quality, and also look deeper at the hormones. If you're postmenopausal over the last 10 years, we'd want to see what's happening there as well, as lower estrogen, lower estriol can have a negative impact on your immune system as well. Heidi writes in, my father's in his 50s. He has a strenuous construction job and is starting to get arthritis from doing repetitive movements every day. What can he do besides chirocare, fish oil, probiotics, any supplements too? So yeah, number one, just make sure he has good soft tissue work. Make sure he has good chiropractic. Make sure he has a decent exercise routine. More for therapeutic, like posture, those kind of things, making sure he's lifting things with his glutes or his hips versus his back, right? Those are just kind of common sense things where you want to use the bigger muscles in your body versus the smaller muscles. So seeing a good functional movement exercise person can be helpful, just to make sure if he is doing exercise, it's supporting the things he's doing in his job. Soft tissue and chiro is going to be helpful. Now, make sure an anti-inflammatory paleo template is going to be huge, because we got to keep the nutrition up, the inflammation down. I recommend bone broth and collagen, probably 40 to 60 grams a day of collagen, just to provide extra building block support for all the connective tissue that's being broken down. I'd also be utilizing, higher doses of fish oil, probably 4 to 6 grams a day, with higher amounts of vitamin C to prevent lipid peroxidation. The vitamin C is also going to be really helpful with the collagen. And I would also throw in some liposomal curcumin. Now, in my line, we have one called Curcumin Supreme. I recommend the liposomal version because it's just better absorbed. It's about 6 times better absorbed. So you get about 6 times potency per capsule with the liposomal. That way, that'll provide some really good anti-inflammatory support. His diet's got to be great, especially if he's older, and his sleep's got to be on track. And things like gluten and alcohol have to be under control, especially if he, wants to have his body in good shape in his 60s and 70s. He's going to really have to start taking care of that, or at least start phasing out maybe into a more of a foreman type of role where he's managing versus doing. But if he's doing it, we got to have that good nutritional support there in the background. Hope that helps. So, hey there, Merritt. Hope you're doing well. Let's see here. Gabe writes in, your thoughts on espresso shots, good or bad? Well, I mean, I think it depends. If it's good quality espresso and it's organic, good quality, and you're doing it, before the noontime hour, I think it won't mess up your HPA axis. It won't screw up your sleep and your cortisol rhythm at night. It just depends on how much you do. Obviously, I like my caffeine with some good fats, so it kind of time releases it, kind of get that slow, steady burn. But if you're going to do an espresso shot, far better than Red Bull or any other stimulant, especially if it's good quality, lots of good alkaloids and nutrients in it. Just try to keep it in the morning hours, and try to limit it to 1 or 2 if you're going to do it. Don't do more. And if you want to mix it with some MCT oil, even better. B Foxy writes in, I have a dear friend in her late 40s, and over the past 5 years, her health has deteriorated, gone from 135 to 85 pounds. 2007, diagnosed with prolactinoma, now breast cancer, friends need help. That's tough. So off the bat, she has to be making, if she has cancer, more than likely what's happening is a condition called cachexia, where the cancer is literally eating her up. So she needs to make sure she's consuming enough calories, and these calories have to be nutrient dense. So doing some of the Gerson juicing could be helpful. I don't like the carrot juice they add in there, but because that's a lot of sugar and can feed cancer. But some of the juicing with the liver in there, I would even throw in maybe an elemental diet or some nutrients that are in, let's just say, powder form or liquid form, to make it really easy for her to digest and absorb. And even like, some Instapot meals where just things are really easy to absorb, but you got to make sure the nutrients are there. Add the additional powder, medical food-based nutrients on top of that. And then I'm a big fan of cancer doing higher dose systemic enzymes away from food to help break down the cancer cells, and also a coffee enema a day is going to be really important, and keep the sugar and the carbohydrates kind of under control. But with her deterioration, I'd want her to be gaining a little bit more weight before we did some extreme carbohydrate restriction, but really work on the fats. Hope that helps. Barbara writes in, Dr. J, being postmenopausal for at least 10 years, I'm successfully losing belly fat and visceral fat. Why are my thighs getting larger? Could this be hormonal or just lack of exercise? So if you're successfully losing body fat, that's good. That's excellent. I would just keep rolling with it. Again, hormones tend to be the key that unlocks some of these fat cells so they can be burnt up. So I keep doing everything that you're doing. Of course, you can target that area. So if you're seeing it's the thighs, you could just do a little bit more interval training, that higher intensity interval kind of Tabata types of movements that involve those type of muscles. You could also do things like lunges, single leg deadlifts, or single leg deadlifts or lunges, things that are going to involve some of these muscles unilaterally to put more neurological stress on it. That'd be a good thing that I would target on top of all the things you're doing, Barbara. All right, Kitty writes in, if you're a young woman who entered early menopause due to an ovary removal with BHRT, bioidentical hormone replacement, what would you do? T.S. Wiley or other? So with the T.S. Wiley method, they're basically taking your hormones and giving you hormones in a way to mimic cycling. So they'll typically give some estrogen or DHEA the first half of the cycle. They may give some testosterone somewhere in there, and they'll typically give progesterone the last half of the cycle to mimic follicular phase, which is estrogen-based, and then the last half, luteal phase, which is progesterone-based. They'll typically do that to mimic hormones of a cycling woman, and then you're going to menstruate as well. So there's two schools of thought. You can do that. The whole idea is that Mother Nature, you're tricking your body into being cycling again, which means you're younger, there's an anti-aging benefit there. Some women who are menopausal are just so happy to be done with that. They're like, okay, let's just kind of support the hormones, estrogen, progesterone, at an even kind of keel level. So we're not going to be cycling, but we'll be giving just a little bit to replace what's missing, right? The stronger your adrenals are, the more the adrenals will come to the rescue to support the missing piece of the estriol, which tends to get converted from DHEA. If your adrenals are weaker, we could throw a little bit of progesterone and estrogen in there, and typically I'll support anywhere in the upper postmenopausal range, or we'll go kind of the lower physiological range for a cycling female. and typically enough to get rid of the hot flashes, help with the mood, help with the crepey skin or the vaginal dryness. That's a pretty good sign. Sometimes sleep will go off. So we'll supplement some of these hormones, one, to get into a physiological range, and then two, we'll want to see a lot of these symptoms start to neutralize. Great question though, Kitty. Jack JMC writes in, how much L-glutamine daily to help heal the gut? Typically, I would say anywhere between a 1.5 to 3,000 milligrams, 3 grams, 3 times a day is fine. Anywhere between 5 to 10 grams per day is great. In my product, GI Restore, it's about that. It's about 10 grams of L-glutamine a day, and you can do it in 2 or 3 doses is fine. But you want to get to the underlying cause. So if we're just putting healing amino acids on there to help those enterocytes heal and recover, we want to make sure the food's not there affecting it. We want to make sure we have enough digestive support, HCl enzymes, to be able to break down our food. And we also want to make sure that we have the infections removed. So if we have H. pylori or a fungal overgrowth, we want to make sure we address it. Let's see here. Keep on rolling, guys. A lot of questions just came in. Okay. Miriam writes in, you never talk about being underweight and how those with Addison's disease can put on healthy weight. I've been eating strict paleo and cannot gain weight. 5'7", only 113 pounds, been paleo since May. So first off, if we have Addison's disease, right, that's going to be a condition where cortisol is abnormally low. A lot of times there's an autoimmunity that's affecting the adrenals. Usually there's like adrenal cortex antibodies that's attacking the adrenal glands. We want to make sure the autoimmunity is under control. So we can do that starting off with a paleo autoimmune template. We can make sure things like glutathione and vitamin D are dialed in. And then we want to look at the gut and make sure there are no infections and things that could be affecting our immune system there. Remember, 80% of our immune system is in the gut, and we want to make sure that we're absorbing and assimilating a lot of these foods. So I'd want to look at your gut. I want to look at absorption. I'd want to look at, how do your stools look? Is there undigested food in the stool? Are your stools floating or sinking? I want to really assess all that. I want to make sure that you're eating enough calories. And again, calories, if we're eating real whole foods, calories are going to have nutrients attached to them. So if we're eating low calorie, we're probably eating low nutrients. So making sure we're having at least the amount of calories we need plus some. And I would probably throw in foods that are already broken down, whether it's crock pot or Instapot meal, or even some elemental medical food that's already broken down in a powder form with a lot of enhanced micronutrients in there to make it easier on your digestive system to absorb. But then after that, we'd have to look at supporting your adrenals if there really is an Addison's deficiency where the cortisol is that low. So question is a good one, just a lot deeper than what we can answer here. Dennis writes in, can chiropractic neurologists treat psychotic disorders? So if you mean like bipolar, manic depressive, anxiety, depression-based issues, I mean, typically from an adjustment, I would say that's going to be more biochemical based. So gluten has a major component with that. Obviously, being able to digest and break down protein, your gut has a major component on that. So a lot of chiropractic neurologists are utilizing functional medicine and diet into what they're doing for neurological exercise and adjusting. So yeah, it's possible a good, well-rounded, holistic chironeurologist would be able to help you with that. They'd have a lot more tools in their tool bag. Kitty writes in, see, Akimo writes in, what would increase one's tolerance to para-1 and silver? They are currently intolerant. So yeah, so Akbar, if you're having an issue with some of the clearing herbs, you'd want to follow the die-off reaction handout. If anyone has issues with clearing herbs, it's typically because we're killing things off too fast if we're using specific antimicrobials, and that's affecting and stressing out our immune, our lymphatic, and our detoxification system. So we can slowly ratchet some of the herbs in, go 1 capsule at a time, get to what your max dose is, or back off by 1 if we have negative symptoms. We can add in the ginger tea like I'm sipping now. This is kind of a pull from the GAPS protocol, Natasha Campbell McBride, where we use juiced ginger. I'm using royal jelly in here and some lime half squeezed. And that can be really helpful at just supporting the lymph. We can always add in some binders too, such as activated charcoal or bentonite clay taken away from food and supplements. And we can even add in something like glutathione too to really help make sure these detoxification pathways are moving. Okay, Monica writes in, happy Friday, Dr. J. Planning to do coffee enema after holidays. How much water? How much coffee? That's a great question, Monica. I would utilize the Gerson's protocol for doing a coffee enema. I'm not a specialist in that, so I won't pretend to be here on YouTube, but just Google Gerson method and coffee enema, and there's a couple of really good YouTube videos that I refer to my patients when they're going to do that. Irma writes in, I tested for baker's yeast, brewer's yeast sensitivity, and I have Candida. I read Espellardi is great for combating Candida, but isn't that also a yeast? So I think it is, yeah. So nutritional yeast is more B vitamins. It's not like yeast like Candida yeast, but baker's or brewer's yeast may have more of a Candida aspect to it because there's yeast in there, where nutritional yeast is more B vitamins. So I would be careful with baker's and or brewer's yeast. You'd probably be okay with nutritional yeast for additional B vitamins. Chronic condition writes in, I have a noticeable neck pulse all the time. I'm not running around or anything. It wakes me up. It's still noticeable. Any reason? Well, it could be just a spasm in the muscle. So I'd make sure your minerals are dialed in. Potassium, magnesium, sodium, chloride. Make sure you're getting enough good minerals. You can use a good real salt, Redmond's real salt, salt your water. Make sure you're getting 4,700 milligrams of potassium a day. You can run that through Chronometer. A good way to make sure your potassium is good enough, typically 6 or 7 servings of green vegetables, a full avocado, and either a sweet potato or a squash, medium size, will get you there. But feel free and run that through to see where you're at. James writes in, Dr. J, happy Friday. Is there a difference between juice drinks with 42 grams of sugar, high fructose, or 100% juice, no high fructose, but the same sugar content? Well, in general, if you're going to be consuming like juice that's like fresh juice and the fiber's pulled out, I mean, you're still getting the same amount of sugar. I mean, it's very similar regarding the percentage of high fructose is, I think, 45 glucose, 55 fructose. I think it's a 55-45 blend. And it's very similar if you're getting natural fructose. I mean, the difference would be high fructose corn syrup is going to come from corn, and there's some mercury used in the processing of it. So if you Google high fructose and mercury, you may see some of that. And there's a good chance that if it's not organic, that it's coming from GMO, Roundup, glyphosate corn. So of course, it's better to do fresh organic fruit. All right. Even better than that, I would just eat the fruit whole. That way you're getting the fiber. It'll time release it better, and you won't have that big glucose spike. So very similar, but I would say there's less toxic stress because of the mercury, the Roundup, and more than likely better nutrition, but I'd rather just eat the fruits fresh. The only juices that I will do are vegetable juice without carrot, and I'll sweeten it maybe with a little bit of ginger, lime, or half a green apple. Body Without Soul writes in, how much has the worst patient spent on you? Cost? I mean, it depends. I mean, I see a lot of patients that are sick that may spend a higher amount of their money, a higher amount, in general. And some patients maybe just, $2,000-$3,000 over a course of 6 months because they're already in really good shape and have a really good momentum already going with their diet and lifestyle. So it depends. I see patients that have been sick for over a decade, some that have just been sick for a few months and still have good diet and lifestyle habits. So it really depends on how much the physiology has been hurting. Kim Lackey writes in, a good friend of mine, a type 2 diabetic, 55-year-old, is having to go for iron infusions. What could be causing this? Diabetic male. So it's not a woman. So typically I think of estrogen dominance and women menstruating too much, but that wouldn't be there at that age or with that sex. But with the guy, I would think malabsorption. Either he's vegetarian, vegan, and or he's not absorbing the food he's eating. So it could be an achlorhydria thing. It could be an infection thing. It could be a vegan vegetarian thing. So really hard to say on that. But those would be the kind of the differential diagnoses I would check off as I went through my list. Colin writes in, high dose MSM powder, good for autoimmune. Well, MSM is going to be sulfur rich, right? Methyl sulfonyl methane. So good sulfur, I think that'd be fine. Again, it would potentially push some detoxification pathways. So if you're toxic or have extra toxins on board, it's possible you could have a little Herxheimer's or die-off reaction. So go easy on it if you have any negative symptoms. Jack JMC writes in, does bulletproof coffee break a fast? Technically, yes. The benefit of bulletproof coffee is it's a modified protein fast. So you could still do it and still be in a relative protein fast, which you could still get some of the cellular autophagy benefits without necessarily not consuming any calories. So yes and no. You'd still be in a modified protein sparing fast, but you would not be fully fasting. Foxy writes in, that's a huge problem. I can barely get her to eat a lot of days. Right now, she's doing soups and Ensure. Yeah, so I would not do Ensure, though, but I would definitely look at doing a higher quality elemental diet or a medical food. Absorb Plus has one. Integrative Therapeutics has a physician elemental formula. Metagenics has one that's a medical food. I think it's not Ultra Clear. It's Ultra Inflamex. That's a good medical food as well. That's lower in sugar. That'll get a whole bunch of vitamins and minerals. Definitely stay away from the Ensure, though. It's just kind of basic. I even think it would have maybe high fructose corn syrup in there from corn too. So not good. Why is soy bad when Asians consume it all the time? Great question. So go check out Kayla Daniels' book. I think it's The Ploy of Soy, or The Whole Soy Story. Basically, the types of soy that Asians have been consuming for generations have been more of the fermented variety. Soy in the form of like tofu is relatively new, the last couple decades to generation or so. So soy wasn't typically consumed how it is now. It was consumed more as a condiment, like you would use ketchup or mustard on your food. Is kind of consumed like that. And the fermentation would decrease a lot of the phytoestrogens. It would decrease a lot of the phytates and mineral blockers and trypsin inhibitors that would affect protein digestion. So it's more how it was consumed. Let's see here, y'all. Where am I at? So many questions coming in. Not going to be able to answer everything. Okay. Colin writes in, if having Hashimoto's without antibodies for years, but elevated TSH with thyroid glandular be necessary? Yeah. I mean, if your TSH is elevated, you're definitely going to need some thyroid hormone support to bring it back closer to 1 on the TSH reference range. And you didn't really mention anything about T3 or T4 level. So I would need to know more about that. Monica writes in, lab work shows ALT around 41. That's a liver enzyme, alanine transferase. Range says 7 to 35. So yeah, a little bit high. MCHC 30.4. What does it mean? So when I see MCHC that low, I potentially think low iron. And when I see ALT that high, it's not super high, but there's definitely some liver stress. It could easily just been you worked out a little bit hard a day or two before the blood test, and those breakdown in muscle is what's causing some of that. So I'd look at retesting in a few months and be careful with the exercise before it. Do I have, let's see, I've been suffering from SIBO. What supplements will help the bad odor and flatulence? Again, you need to address the bacterial overgrowth. And there's diet strategies, there's supplement strategies for digestion, but you'd want to address the underlying infection. I've done a specific podcast on that. So just head over to justinhealth.com and just type in SIBO and you'll get some good info on that. Heidi Lee writes in, thank you so much, Dr. J. Hope you and your family have a wonderful holiday. Thank you very much, Heidi. Merry Christmas to you. Miriam writes in, my stools are fine, but still underweight. Make sure you're eating more. Make sure it's nutrient dense. Make sure HCl and enzymes are dialed in. And if not, need to see a functional medicine doctor like myself. Let's see here. Okay, best friends continues bleeding for about 1.5 months. What should I do to stop the bleeding? Well, it just depends. There's definitely estrogen dominance going on there if we're talking like hormonal hemorrhagic type of bleeding. So you'd want to fix the underlying issue there. There could be some fibroids as well. So you'd really want to get, evaluated by a conventional medical doctor just to see what's going on there. They may want to cauterize something if the bleeding is continuous. If not, you got to fix the estrogen dominance and you need to make sure your iron's not dropping during that time frame. So I would at least look at eating some liver or getting some high quality chelated, glycinate or bisglycinate or gluconate, good quality iron. In my line, we have one called Iron Supreme. It's a bisglycinate. Something like that is good. And or liver glandular, because you will probably be going anemic with that kind of bleeding. Jack JMC writes in, betaine HCl is starting to give me burning pain. Does that mean my stomach acid levels are back to normal? I just back off. It's potential. Are you taking it? Make sure you take it with food and then just back off a bit. And of course, how much you eat at each meal will affect it. Think about more protein, you can handle more HCl, right? Think of the HCl. Think of the protein as like the sponge. If you have a bigger sponge, you'll be able to soak up more of that HCl. So bigger steak equals bigger sponge. Marie Lederman. Okay, got good. Let me keep on rolling here. Best friends, I'm 30-year-old female having SIBO. Yep, we talked about that already. Spartan writes in, hi, Dr. J, I work in a body shop, so surrounded with chemicals. My question is astragalus a higher dose for the kidneys? Is higher dose NAC for liver protection? So in general, your question would be what to do because you're in a body shop. So I would try to make sure wherever your office is, unless you're working on the cars, I'd make sure that you have a good air filter. Ideally, that's really important. I'd make sure things like glutathione and or herbs like milk thistle, those type of things are used to really help your liver, to help tonify support, to help with detoxification. I'd make sure things like air filtration, glutathione, you could do sulfur aminos like NAC, milk thistle, all those kind of things are used, even some extra vitamin C as well. So I'd really keep an eye on that. And I would do some tests, organic acid tests to look at your glutathione levels to make sure they're adequate. Okay. Thank you so much. Merry Christmas. I appreciate it. Olga writes in, what can be the cause of heavy menstruation a week every 3 weeks instead of 4? Estrogen dominance. So more than likely there's some estrogen levels that are out of balance and or your progesterone's falling out early in your cycle. And that's what's triggering this excessive bleeding. So you really got to get the estrogen dominance and the hormone imbalances under control. Let's see here. I'm going to go over to Facebook for a second. Hey, Stefan, he writes in, why do people get nausea on the elemental diet? Is there oil or fat in there? Well, it depends. I mean, elemental diet is typically supplement based. Some of the elementals you can add in like an Udo's oil or an MCT oil. So, you'd want to make sure the fat's not excessive. And you can always do the ginger tea because ginger is an anti-nausea. So it could be the fat. And then I would use the ginger as well to soothe your tummy. Okay. Keep on rolling here. Dr. J, how would you treat kids who get colds often and get sick around other kids? Doctors prescribe most of the time antibiotics. Great question. So I'm dealing with that with my son. He's doing pretty good. He gets cod liver oil twice a day. He gets liposomal vitamin C once to twice a day, especially when he's sick. And there's a couple of little herbal formulas that we give him at nighttime, or we give him higher amounts if he's around kids. There's some herbal formulas with astragalus, some medicinal mushrooms, some golden seal, some echinacea. So we give them some of these various formulas. For the kids, I like the Gaia herbs. They have a nice kids line. I like it. It's sweetened with glycerin too. So my son has no problem getting it down. And then we'll also do liposomal vitamin C. And then we keep the sugar really low. So any sugar he gets is going to be primarily just from like fruit, whole food fruit, and then healthy proteins and fats. And then we'll up his vitamin D and give him a little bit more cod liver oil too. And then just kind of common sense stuff. Like the only time my kid ever gets sick is if we bring him to a public area where there's just lots of kids that have used different things. So we just try to avoid a lot of the public places where kids may slime stuff. And that tends to be provide a huge decrease in the exposure. Let's see here. Is it common to have a deep-rooted yeast infection that doesn't show up on a GI map? Yeah, it's possible. When we look at yeast issues, we're going to look at fingernails, like yellow discolored nails. We're going to look at thrush or white coating in the mouth. We're going to look at any tinea versicolor rashes. We're going to look at yeast infections, jock itch, athlete's foot. We're going to look at the clinical symptoms that tell us there's yeast as well. And a lot of the herbs we'll use to treat an underlying gut infection will have some anti-yeast qualities. And then we'll also, on the flip side, we'll tend to use a lot more Saccharomyces boulardii when we get to that 5th R repopulation, reinoculation on the probiotic side. Can too many supplements make your liver toxic? I mean, it just depends. If you're using clean nutrients, less of an issue. If you're using things that have other toxins in there, for sure. But I mean, within a reasonable amount, everything that you eat has to pass through your liver. So the food that you eat, everything always gets digested and it goes to the hepatic portal vein. So everything you eat would go through your liver anyway. All right. Kitty writes in, will Precision Analytics add new markers for the GI map in early 2019? So Precision Analytics is actually the Dutch test. The GI map is Diagnostic Solution Laboratory. So just 2 different labs there. Let me see here. All right. Jack JMC, I read that alcohol is a biofilm buster. Is that true? Potentially. I mean, I imagine it may have some effects that are antibacterial. I mean, think about it, right? If you look at the old days in the West, they would use whiskey or a vodka to help sterilize a wound, right? So obviously there's some antibacterial qualities in alcohol. Keep your alcohol clean. You know, typically if I'm going to do it, I'll mix it with some kombucha to get some extra B vitamins in there. And that's a good way to do it. Just use a clean, clean alcohol like a Tito's, and that may have some benefits. Now, the problem is, are you going to be able to consume it all day throughout a treatment? Probably not. So that's where something like ginger, if you go online and Google ginger and biofilms, or silver and biofilms, silver and ginger are going to be the best, in my opinion, biofilm busters along with NAC. Doctor, I'm having a sore tongue, which will be healed only with digestive enzymes. If I stop taking enzymes, sore tongue comes back. What's the reason? Hard to say. I mean, we talking sore meaning like canker sore, or are we talking sore like in the actual glossopharyngeal muscles? And then number two, I would look at food allergens first. And then you can do things like deglycerized licorice drops, something that's really healing or soothing on the mucosa of the tongue. It really depends. Are you talking surface level sore, or are we talking muscle sore? All right. I think we hit all the major questions here today, guys. Excellent. I got to jump on a patient call. I'm going to try to be back on here before Christmas. So I wish everyone here a Merry Christmas, Happy Holidays, and I'll be back on Monday. And thanks so much for the great questions today. Have an awesome weekend. Take care.